And what the Congress needs to understand if we're going to tackle this opiate crisis is that we can't look at housing over here and their budget, the DOJ and criminal justice over here, HHS over here, and think that all of those budgets don't impact on each other when it comes to the importance of providing the whole spectrum of care that a particular person needs at a particular time and place. And when you pull out the one leg of the stool, the whole thing's going to fall over. But we don't think like that in Washington. We think just budgets for this and budgets for this, neglecting the fact that this is all one person who's circulating within all of those systems, and we can't wrap around ourselves to this idea that what we need is whole budgeting. Like Rod said, that's the answer, because if we do that, we'll realize we'll reduce CMS costs if we expand affordable housing. We're going to reduce we're going to reduce incarceration and parole and all the costs of arresting, adjudicating, processing, and jailing people. All those steps cost money. Reduce all those costs if we provide better primary care, early intervention, like we would any other illness, and treat people in the healthcare system. Now that puts a responsibility on the healthcare system. And I would say the real challenge for us now is like parity. Parity says inpatient in-network, outpatient in-network, inpatient out-of-network, outpatient out-of-network, pharmacy and ER benefits. You must have the same primary care, same secondary care, same tertiary care as someone with cancer, diabetes, or cardiovascular disease for those with mental illness and addictions. That's what the parity law says. And this country agreed and said this is the way we're going to treat these illnesses, the same. So we can't have any more onerous medical management practices, medical necessity determinations. So the real challenge for us now is how are we going to do this? And I believe part of the approach is to create an NAACP for mental health and addiction, because we don't have a voice out there. And this is a medical civil rights movement, because you see, mental health and addiction is treated separate and unequal. It's carved out. In 50 years, they're going to look back and say, what in the world were they thinking? Just like we look back now and think about the days of Jim Crow, and we're saying, how could we do that? Why aren't we treating these illnesses like any other illness? And I have to tell you, Frederick Douglass got it right. Power concedes nothing without demand, never has, never will. So we're putting together a group of hotshot parity attorneys, and we're launching parity investigations of our major payers around the country. And I already talked to Sister Carol about this. I believe that we need to be strategic about what states, what cases we take on. Because this is like trying to get a new normal, new common law, accepted practices that you can't discriminate. You've got to do the screening for mental health and addiction early, just like you would any other disease, and not wait till the disease becomes a stage 4 illness and is in your emergency rooms, right? Is that where we start treating people? In the ER when they're overdosing. That's exactly our method of treating addiction and mental illness today. You have a psychiatric break, guess what? It takes you years before you get put on the right medication. Your illness has pathologized, your ability to recover has been diminished. All that can be solved tomorrow if we implement best practices in terms of early intervention on schizophrenia.